Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In previous Lifestyle Medicine Updates, I've reviewed the evidence showing that ideal blood levels of vitamin D were able to help prevent acute respiratory distress syndrome, and that studies from various countries showed that this may also be true for COVID-19, as published studies suggest that individuals with lower vitamin D blood levels are susceptible to having more severe COVID-19 infections and greater risk of death. So studies like these prompted a Spanish hospital study to be undertaken whereby 76 consecutive patients with laboratory-confirmed COVID-19 cases who were admitted to the hospital were provided with standard medical treatment for COVID-19, but 50 of them were given vitamin D supplementation and 26 were not given vitamin D supplementation. The study was done using a computer-generated randomized approach as to who received the vitamin D and who didn't to eliminate the risk of doctor bias. The results showed that of the 26 patients who did not receive vitamin D supplementation, 50% of them had their infections progress to a point where they required admission to the intensive care unit, and 2 of them ultimately died. Of the 50 patients treated with vitamin D, only 1 required admission to the intensive care unit, and none of them died. None of them. As the researchers explained, patients with inadequate vitamin D status are at higher risk for more severe pulmonary infections such as acute respiratory distress syndrome. Vitamin D is required by immune cells to synthesize agents that literally destroy offending viruses on contact. More specifically, immune cells require vitamin D to synthesize cathelicidin peptide, defensins, and the TLR co-receptor CD14, all of which help immune cells kill viruses on contact. Now, admittedly, this is a small study involving only 76 COVID-19 patients, but the positive results of the study have prompted a larger, multi-center trial involving 15 hospitals across Spain to be undertaken immediately. The new study will treat COVID-19 patients with either vitamin D or no vitamin D concurrently with other standard treatments of COVID-19 that are improved in that country, which, by the way, include the use of hydroxychloroquine, azithromycin, and in patients with pneumonia, the addition of a broad-spectrum antibiotic. For patients on ventilators, the steroid drug dexamethasone is also being used, as it has been shown to reduce mortality in hospitalized patients with COVID-19 who are on respiratory assistance. Now, keep in mind that the current study that I just spoke to you about in Spain, that these drugs were being used as indicated on all 76 COVID-19 patients, but it was the addition of vitamin D supplementation that significantly improved the outcomes for the patients receiving the vitamin D compared to the patients who did not receive vitamin D. So the evidence continues to point to the importance of maintaining a blood level of vitamin D between 85 and 125 nanomoles per liter, which enables immune cells to mount a more effective attack against invading viruses and other pathogens. So I've included the reference for this study in the text below. Thanks for watching, and I'll see you next time.